Hey everyone, welcome to the show. Thanks for being here on Housing Jersey. I'm Jay Everett with Keller Williams Realty, the Ocean Living Office. I am so excited about our conversation today because I am really passionate about finding solutions that help end homelessness. And today on our show, we have someone who founded an integral model called Housing First. So what is Housing First? What's the method? What's the philosophy? And how can it help end homelessness in our state? Answers today on Housing Jersey. So thanks everybody so much for being here. I'm so excited because I've just met someone who I've only ever read about in the history books and in the literature recently. So I would love for him to introduce himself to you and tell you a little bit about who he is personally and professionally.
Hi, my name is Sam Tsemberis. I'm often introduced as the father of Housing First. I'm the guy that started the program in New York back in the early 90s. I am a clinical psychologist by training. I went to NYU and soon afterwards started to work for the city of New York on their emergency homeless outreach team, where I began to meet a lot of interesting people that were living on the sidewalk at that time. And quickly, maybe not so quickly, after a few years of the frustrations of trying to get people into treatment and then into housing, took a completely different approach and took the very good advice of the people I was working with, the clients, who said, isn't it obvious we need a place to live before anything about treatment can even be discussed? And so we started the Housing First program, and that program has been really my life work for the last 30 years, pretty much. That's what I've been doing, developing the program initially, testing it in randomized controlled trials. And once we knew it was solid and effective, we began to disseminate it, first all over New York, and then all over the States, and then Canada and Europe, Australia, New Zealand. So it's been quite a journey in the dissemination of this Housing First program across all of these cultures.
Yeah, and just so folks are aware, that organization that you rolled it out with was Pathways to Housing, right? And you're still affiliated with them?
Initially, it was Pathways to Housing. I started Pathways to Housing New York, and then Pathways to Housing DC, Pathways to Housing Philadelphia, and Pathways to Housing Vermont. Now I work at the Pathways Housing First Institute, which doesn't do operations. It does all of the training and research and program dissemination. I'm the CEO of Pathways Housing First Institute.
Fantastic. Yeah, thanks for explaining that. And, I think to your point, that this model of Housing First has been now, even since I started having involvement with homeless services and planning in the state of New Jersey, it's been in the water. It's been disseminated. It's been widely distributed and promoted all the way up through federal policy guidelines. So if you wouldn't mind explaining to folks, first, maybe what are the goals of Housing First, and then what are the components of the true Housing First model as you have designed it and continue to explain to folks?
Well, there are two goals, at least, for Housing First. And I would say that the first goal is the recovery of the person that we engage in the program. It's really a person-centered program. And that is a much more challenging goal than the other also first goal, which is you can't really start recovery. Or if you start recovery and the person is homeless, step one to recovery is housing. And the program is probably best known as a program that ends homelessness for people with severe problems, mental illness, addiction, health problems, and so on. So those are the goals of the program. But I wouldn't want people to get the impression that it's all about the housing, because housing is just sort of one step in the way to recovery. Although most of the times Housing First is talked about a housing program, but it's not Housing First unless it has supports. The thing that so that's the goal. That's the goal. The goal is ending homelessness for people with complex needs. What was the second part of your question, Jay?
The second part was if you could then explain what the model actually is, because you
Right.
mentioned those goals of housing
Right.
and recovery.
Right. It's difficult for me to explain the model unless I sort of lay out a little bit what the model isn't, and then I can tell you what it is. Because in America, we have been dealing with homelessness for about 3 decades. And in our initial response, in our initial national response, we assumed, like we often do, kind of a bit of a blaming the victim mentality, where the homelessness is caused by some personal failing of the individual. So that, well, this person looks like they have a mental illness, or they're poor, they may have squandered their money, or maybe their mental illness made them homeless, or they have an addiction, clearly that played into their homelessness. And while all of those things are a little bit true, we have had mental illness and addiction in this country for many centuries, but we haven't had homelessness until the 80s. So it doesn't actually line up that it's the mental illness and the addiction. Otherwise, we'd have been dealing with homelessness for forever. It's really a more recent phenomenon, which was created by the federal government since the Reagan era, pulling out of the investment in social services and social safety nets. And we're seeing it big time manifest today during the COVID crisis, where the federal government is essentially bankrupt in leadership and resources to help the country address this crisis. And it's because we have stripped away social service programs and social safety nets, where we're still the only country that has no national health plan, and no education affordability, and many other things that the rest of the world does. And per capita, in the United States, we have more homeless people than any other country internationally for these reasons. The real estate market, of which you are a proud member, has done very well, because they have boomed during that same time tremendously. So benefits either stagnant or staying the same, real estate values going way up, people with mental illness and other disabilities on fixed income, Social Security income, or other benefits were early on priced out of the market, because the market became a for-profit market, because the public housing market essentially flattened out, disappeared as an option as the population grew. So you had no public housing being built after 1980, essentially no public housing, not even maintaining the existing public housing, real estate moving far too fast for people on fixed income and very, very poor people to get into it, and homelessness. So rather than looking at these macro structures on the causes of homelessness, we began to try and fix people. Let's fix their addiction, and then they'll get their act together, pull up their socks. It's the American way. Or they should get treatment, or they should go to shelter, like we tell them. People who are mentally ill are afraid to go to shelters. It's too crowded. And it's not a cure for mental illness anyway. So they're not choosing to be homeless. They're just choosing not to take what's being offered. It hasn't worked for them. And people with addiction struggle mightily to manage addiction when it's that severe, and being homeless is just another way of having to knock themselves out in order to be able to tolerate the homelessness. It's very hard to get off drinking or using when you're homeless. But the model we set up was to treat the illness and the addiction first, and have people earn their way into housing, prove that they are worthy for housing. And that's still the predominant system in the country today. But it doesn't work for a lot of people. That's why we continue to see people on the street, and we developed this term called chronic homelessness for those people that have been out there for a long time. And that's the group that I was working with. And with that group, we decided there's no point trying to push them up the stairs once again. Let's try something else. Well, what do we try? So we don't really know. And so, do you have any ideas? Well, they had a lot of good ideas. They've been at this for a while. And so really it was that kind of allowing the people we were designing the program for to have a lot of input into how the program was designed that made it so successful. You know, I mean, in business, that's probably standard practice. You want to develop a new product, you bring in a focus group of invested stakeholders and you say, what do you think about this product? And you kind of, you know, adjust it so when you hit the market, it, you know, it sells. Well, Housing First was definitely a focus group developed program. We brought people together, said, we want housing. No, 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 we don't want one of these big buildings where 20 or 30 people with severe mental illness who were formerly homeless go into. I don't have mental illness. Most people with mental illness say they don't have mental illness. Whether you have a lot of it or like the rest of us, a little of it. But, you know, it's not something that people want to admit their vulnerabilities. So they don't want to be identified as being in a program. They don't want to identify as being in that kind of housing. And they wanted a place of their own, a simple place, you know, some had or they grew up in, you know. So individual apartments integrated into the community was a mandate, most preferable type of housing in surveys of homeless people everywhere. And then, you know, maybe they'll go to treatment, but they didn't want to live in a place where the social worker was in the basement. They didn't want to live in treatment. They wanted to go to live in a house and go to treatment, maybe. So we had to agree that, you know, you don't have to be in psychiatric treatment. You don't have to be clean and sober. You're just going to go into this place and meet the terms and conditions of a standard lease, pay 30% of your income towards the rent, wherever your income is. Most people had SSI. And you have to agree to allow us to visit once a week. It's not housing only, it's housing first plus the services. And the services are not mandated. We're not coming there to, you know, make you take a drug test or swallow a pill. We're there to see that, you know, we just house someone who's been homeless for years. They have schizophrenia, they might be using, they have health problems. We need to have eyes on them to make sure they're okay. That's what the home visits are about. But, you know, we're sending social workers or nurses or psychologists or caseworkers or people with lived experience. So the hope is that in that home visit, we're going to engage people in the treatment that they need. And that's how the program unfolds. So it's housing first, right from the street, or right, you know, then it became from the shelter, from jail, from hospital, you know, people who are chronically homeless. And right from their homelessness into a place of their own with supports.
Right. And if you wouldn't mind, you touched on it in terms of the supports that are available. As originally conceived, it was really an interdisciplinary team that was arrayed around the individuals who were needing various types of supports. I think the way that it's manifested in a lot of ways in New Jersey are maybe limited to someone who's a social worker checking in on a periodic basis, or if it's someone who's eligible for Medicaid services, it might be a specific type of licensed clinician that could provide that assistance, but it's not necessarily an interdisciplinary model as executed in a lot of cases. So can you just explain what the dynamics were as originally conceived and what the advantages were?
Yeah, well, it was originally implemented with the money that we had from the state, which was really money for rent and case management. And it was like, you know, we were desperate. We didn't really know what we were doing. And said, well, let's try that, you know. But it was evident very quickly that the level of severity of problem that people had was not a case management only problem. And so the principle in Housing First support services is that you have to provide the level of support that matches the needs of the client. And the needs of the client are also not a stagnant thing. When people come in initially, they're not doing very well. They need a lot of support. Then over time, they may need less support. So there's a flexibility to it. But what we have found is if you're targeting people with complex needs, you know, all of these trimorbidities and quadruple diagnostic criteria met, then you better have the kind of team in place anticipating that we're going to have to address those needs, not because the person has to, but we want to engage them in treatment. So the treatment also, you can't bank all of your money on a mental health professional. The person often wants to take care of their medical problems first. So, and they're not willing to go to a clinic, and you know, you have to kind of bring them along to acknowledge that the medical problem is urgent, needs attention. So a nurse is very helpful to have. Other people move in and they're like, I'm okay with this. I need a job. You need an employment specialist, you know. So you want to have an interdisciplinary team, ideally, you know, but many communities don't have either the resources or the billing ability to create an interdisciplinary team. So you can have the program operate with a case management team with low caseload ratios. And that case management team takes responsibility for all of the services, but they do it through a brokerage model.
Right.
The important thing is that the services have to be of that mindset that we're going to have people with a lot of needs. Either we provide them ourselves, if we can manage it, that's ideal. But if you can't, then the case management model with a lot of good interconnectedness to community resources, you know, if they exist, is another way to operate the model. You're absolutely right that because now the program has become sort of mandated by the federal agency, HUD, with no guidance or finances to actually implement it, lots of communities say they're doing housing first, but it's really more of a lip service, and especially on the services side, that they're not really providing the kind of support people need.
And you know, I think that to your point about that, it's not just that the communities might not want to be better in terms of the service richness that's arrayed for the consumer, but their conception of housing first, I think in a lot of ways centers around the housing first part, right? Which is, let's make it low barrier to entry. We're not going to exclude folks. We want to, you know, screen folks in to the project or to the housing opportunity. It's that critical part that you mentioned, one of the two goals of the program, which is assessment of needs on an ongoing basis, and then provision of those, whether through brokered or through, you know, close-knit provided services. That sometimes that's just a very big lift that folks don't quite know how to understand, and they need that kind of training that I think you and your institute provide. So, you know, I'm just going to try to make it a very hard and clear stop for folks here in terms of what you've just discussed is really the actual model of permanent supportive housing called Housing First, right? And in a lot of cases, as you alluded to, when the federal government or HUD is putting out a notice of funding that's available, they're using words like housing first philosophy, right? Which I think talks about reducing the barriers to entry or to termination for the programs, but it doesn't necessarily specify that model implemented. So to your mind, Sam, what are the differences, and how do you talk about the difference between the housing first model and the philosophy?
It's a little wonky, you know, because I think it's kind of a little bit of positioning, and I'm not sure what else is involved in that. But the housing first model and program, to me, are clearly defined as being person-centered. So I'm actually not invested in what kind of housing the person wants. If they want to live in a big building that's a program, like a permanent supportive housing building, that's fine with me. Most people want a place of their own in the community. I think that there is a tension in the homeless business, especially among the industry that builds permanent supportive housing. Permanent supportive housing in my mind, is a kind of an institutional model. You know, it actually is a violation of Olmsted. You know, Olmsted is a Supreme Court decision that says that people with disabilities, including people with psychiatric disabilities, should live in least restrictive settings, have access to the community and social and cultural events like the rest of us. You know, it's part of the ADA. It's what made the buses kneel and the sidewalks disappear for people in wheelchairs. And in some ways, psychologically, Olmsted is the guiding principle for how people with mental illness should be treated in this country, that they have a lot of say-so in where they live, and also that they are afforded the opportunities to live in least restrictive settings. Many of the permanent supportive housing programs, not all of them, there are exceptions where the permanent supportive housing is run under the Housing First approach. So harm reduction is part of it, client choice is part of it, you know, to the extent possible, mostly in the services, not so much in the housing. There's no choice in location and so on. So it's kind of like a Housing First model in some of its practices, you know. I think though, that if we're going to really ever think about taking this to scale, the model that I have seen that is sort of ideally a match for what we need, because people justify the building of more and more permanent supportive housing as a way to end homelessness. It's ridiculous as a long-term plan, because you work for 3 or 4 years to build something that's 20 or 30 units. Now, it keeps going on because that's what the industry is, and we need every kind of housing that we can get. That's also true. But if we're thinking about really scale, there have been now examples in other countries where they've ended chronic homelessness. My favorite example is Finland. And what they did there was they went big time in investing in building affordable housing. They essentially, and this is what we need in this country, 350,000 units of affordable housing, public housing, went away. We've never replaced that. And these 20 or 30 units of permanent supportive housing across the country, even if we're doing 1,000 or 2,000 a year, is nowhere near the scale we need. How do we bring affordable housing to scale if we don't have a federal government, or we don't live in a country that has that kind of the social values about public housing? I think the Finnish example is informative here, because what they did, they put the housing, they endowed a foundation, like essentially a nonprofit, government, business, faith community, huge investment in ending chronic homelessness. And they began to essentially rehab, purchase, or otherwise acquire any kind of housing available on the market. They even got the national lottery money committed to converting shelters. They had lots of shelters into studio and one-bedroom apartments, okay? So they have, some of the buildings are standalone buildings, others are converted shelters, some are just independent apartments here and there. They only had 2,000 homeless people in Finland, okay? They acquired 12,000 units of housing.
Wow.
What are they doing with the other units? What they're doing with the other units is that they are renting them out on a sliding scale, so that they have a real estate portfolio of 12,000 units. Some of them, about, I don't know, what's 2 out of 12, like 12%, 15% are for the chronically homeless. So those units are subsidized, but the other units are generating enough revenue to make the entire portfolio financially sustainable. And because it's a nonprofit and you're not having to pay stakeholders, you know, margins and profits, it's being reinvested into the thing. And so there you have a model, integrated housing, in the community, uh, financially sustainable, and of a scale. In 12,000 units, there's always someone moving, dying, leaving to go somewhere else. There's always a couple of vacant units. There's that kind of the business as usual. So as people are falling into homelessness, at a trickle, there's more than enough capacity to get people out of homelessness. So that's, to me, a beautiful model of smart, practical housing. The services in the Finnish model are not provided by the housing provider. They are provided by NGOs that do social services, which is another useful principle in housing first. It's like the second principle. The first one is client choice. The second one is separation of housing and services, which is difficult to achieve in a single site building. Why do you want separation of housing and services? Because not everyone succeeds in the apartment that they move into. Housing First has an 80 to 90% success rate in having people move out of homelessness and into housing. It's an extraordinarily successful program. We didn't talk about that, but that's the reason everybody wants to implement it, because when you implement it correctly, those are the results you get. So why separate? Because only 60 or 70% of the people that go into housing are able to maintain that apartment the first time. Some people lose it, they get evicted, their friends come in, they just can't manage it. And there's a learning that's required. So you might lose that first unit. If you have housing and services separate, the service support is not lost because of the eviction. The service support helps the person find the next place. And we know from research, like the Canadians did a randomized controlled trial of over 2,000 people. We have lots of data on this program. People going to their second apartment do better statistically in terms of retention than people in the first. So the first time you might get a 60 or 70% success. The second time it's 70 or 80. So people have learned something and don't repeat that mistake. They learn the way we all do. They make a mistake and they learn from it. So that's a very useful thing about having the separation. Also, if people get hospitalized, remember we're dealing with people with sometimes severe conditions of addiction or mental illness. They might go to detox, a long-term drug program. They might get arrested. They might go to the psychiatric hospital. They leave the housing. The support stays with them. When they complete treatment or they serve their time, the support services are there to help them back. That's what I meant about the recovery focus. The program is long-term committed to helping that person get their life together, not necessarily get their apartment together. I mean, of course we want that too, but you see how the commitment is to the individual rather than the housing.
Right, absolutely. And I think that your point about the focus, the real true, myopic focus on consumer need is, I think, something that a lot of providers continue to struggle with because they're worried about the operationalization of their program and just keeping the program, moving forward. And it's maybe sometimes difficult when it's not at scale to focus on that one difficult consumer potentially.
I think a lot of single site buildings focus on the one consumer that's problematic and usually looking to evict them. Because it doesn't, from a management perspective, it's also very difficult to manage clients that are disruptive when you're trying to keep a building safe, secure for everybody else.
Right.
And so there is, I'm not trying to say that operating Housing First in the way I'm describing is an easy thing. It's very challenging, every day. It's a harm reduction program. People are doing all kinds of unpredictable things, and you have to anticipate that just because the person is housed, it just means that a whole new set of challenges about adjusting to the community and the building happen. It's not like the end of the story, just the beginning of another story,
Sure, absolutely. And, I would just ask your opinion briefly, Sam, on whether, in your opinion, the wider adoption of the Housing First label or parlance has broadly helped people understand the value of low barrier housing assistance interventions, or whether it has diluted the original, intent of really consumer centric programs.
Yeah.
What's your opinion?
Well, my opinion is it's done both. I think that it's certainly everybody has heard the term in some way. They may not understand really the actual operational principles of the program, but it's a good thing that people know there's such a thing as housing first, and some people go into apartments right away, even if they misuse it. But it's also created the opportunity for kind of policy discussions that have been effective in having more programs manifest. Yeah. Although, it's interesting. We're having this Zoom meeting, and we're living, under the pandemic, and advocates for housing first have been saying all along, it's really very, very important that we get people into housing right away. They're not safe. It's not healthy for them. It's not healthy for us. It's a public health issue as well as a public safety issue and a safety issue for the people on the street. It's expensive because it's actually cost more to have somebody homeless than put them into housing. We've been saying this for 20 years, and it's like, and the mayors dutifully come and say, oh, homelessness is an emergency. We have to house everybody. And it hasn't happened. Now we have COVID-19, and mayors and governors are like, let's get these homeless people into housing right away. It's like, no questions asked. And the money is around, and it's like, wow. It's like from, no, you can't get housing to you must be in housing. And no one's talking about that in terms of housing first, but it's the sort of the irony of it all is not lost on me, that the pandemic is sort of demonstrating the clinical and practical usefulness of why it doesn't make sense to have anyone homeless in our society.
Yeah. And, I think bringing it into, our society, obviously the context of our conversation is, the state of New Jersey, where, my expertise is, and I know I've been very excited to come to find that you live in our fair state. But so from that lens, what would you say to folks who are maybe policy leaders or local leadership in continuums of care and nonprofit circles? A lot of folks say, well, of course, the housing market is going to box out folks who have these types of subsidies that may be limited to a fair market rent based on Section 8 guidelines. Yeah. What do state and local leaders and community leaders need to have in terms of resources and to know and understand about overcoming those obstacles to get to a sustainable place with housing first?
I don't think we're going to solve homelessness unless we get back to figuring out how to build affordable housing. I don't think the free market will ever solve the problem, because if the free market could have solved the problem or figured out a way to make money on homelessness, we would have had homelessness ended a long time ago. There's no way to solve this unless we figure out a way to bring back enough affordable housing, whether we do it the way the Finns did with a mixed income model, which I think is ideal, ultimately long-term sustainable, and maybe a better fit for our capitalist values, because we're not going to go big time social housing the way they do in other countries. We're not, Bernie Sanders didn't make it.
Right.
So I think, the housing solution is the big thing. But on a small scale, in terms of the continuums, I think that they've been around for a long time, and there's a tremendous vested interest in keeping everything the same, keeping the shelters funded, keeping the transitional programs funded, and a little bit of money for permanent housing, as long as HUD is nudging that way. Every community has to figure out, is there a way that we can get more people out of homelessness than are falling into homelessness every year? Because, homelessness is not a fixed number. So And I think the communities that have succeeded, like Bergen County, right, and Julia Orlando's work there, community effort, uh, a consensus on the approach, that shelters will take a housing first approach, meaning they're not looking to stabilize people, they're looking to move people into housing right away. People that are stuck in long-term shelter beds or transitional housing are moved immediately into permanent housing when those openings happen, creating more capacity in the system. And an overall movement towards investing in permanent housing solutions and figuring out how housing authorities can go to real market value rather than the imaginary market value, which is always like 50% below market value. It's not complicated. We all know, it's out of touch. So it's about money, in terms of affordable rents. And it's about using the little money we have in the homeless sector to make a more efficient system, which can be done. And especially in New Jersey, we have, champions that can go to the other communities and show how it can be done.
Sure.
I think from a policy level, we don't get anywhere because homelessness is too small an issue. I think this conversation about homelessness is better had and will get policy makers' attention if we talk about it in terms of the crisis in affordable housing, because there you have now a much, much bigger constituency. And we're going to see this play out in real time with the unemployment rates being what they are, people not being able to pay their rent. I'm in Los Angeles speaking to you today, and they're already planning for city land to be set up as refugee camps because they're anticipating with the 25-30% unemployment rate, it's going to be only a matter of a couple of months before people run out of their savings and they're going to be showing up in the homeless system. So, we're in quite a crisis right now, but it's really we have to expand the conversation beyond homelessness because it's too small a tent and doesn't really bring to bear the attention and the resources needed to solve the bigger problem. If we could solve the affordable housing crisis, we could certainly solve homelessness because it's just a small part of it.
Right. No, I think it's a tremendous point, and building a bigger coalition around that conversation to leverage is obviously a huge benefit if we can look at it through that lens. Yeah. I love what you said, where pretty much I've explained it to folks. All you have to do is house more people than become homeless in any given time period over and over. But it's super simple to say and super difficult to do, as you alluded to earlier. So I appreciate.
But I think it's important to say it because people have this idea that homelessness is a fixed number.
Right.
And It's actually a process, and we're just at the bottom of a very long river with a pail, getting the flooding so it doesn't just crash over the dam. We're nowhere near the source. I mean, we'll be busy forever bailing out homelessness in the way we're going about it now.
Right. Yeah. And, I think one of the things that we may not have addressed for someone who might be listening or seeing our conversation, Sam, is the point you made about the cost and about the expenses that have to be made or undertaken in order to make solutions happen, that some folks in local communities, when there is in the perceived mind, a limited pie, right, of resources, and they have to allocate them to all different aspects of need in the community in terms of housing assistance, that the 80-20 principle, those folks who are maybe a small portion who are experiencing long-term homelessness or multiple morbidities, they may take so many more resources to house in a single consumer than maybe other populations. So they struggle with that investment. But can you just contrast that with your earlier point about what it costs the community and various stakeholders in terms of the long-term costs of keeping someone not housed?
Well, this is another reason to bring the conversation beyond the homeless community, right? Because if you bring it to the municipality is a good jurisdictional area. Certainly it also holds true for the state. But if you start looking at the homeless population in the way that you just described, sort of the 80-20, 20% of the homeless population is using up enormous resources uh, while they're homeless, so that they're using up resources in emergency rooms. You know, this is why we're housing everyone during the pandemic. We're afraid with a fixed number of emergency room beds and respirators, if we don't take care of people who are homeless, they're going to flood all of the resources. There'll be nothing left. That's already happening in many ways. That 20% is using up 50% of shelter resources, of emergency room resources, jail, prison circulation, very high for them. So from a jurisdictional perspective of running a city or running a state, the small percentage of homeless people are taking up millions of dollars more of acute care resources, and it would save those other acute care services a lot of money to simply house and support those people in an apartment of their own with even an interdisciplinary team looking after them. It would reduce their use of those services. So there is a cost offset to all of this. It's not going to be, it's a cost offset. It's not like we can take the money out of criminal justice and hospitals and move it over there, but the argument can be made very convincingly when communities look at their data,
Yeah.
service utilization data. It's there.
Well, and I think that's the critical piece that you mentioned is having the ability to get a good cross section of that data across multiple different institutions that someone might be engaged with, and be able to make that determination of how the various parties can effectively communicate about how they can contribute in an equitable fashion toward the solution that they all benefit from. Because I think that a lot of times it pits the hospital versus the police versus the social service organization, because it's a problem that everyone continues to deal with, and it doesn't then get to a conversation where everybody is talking about how it solves it for the consumer. It's mostly about the resources.
Right. And I think you could make it absolutely beneficial to the stakeholders. I mean, you can set up a housing first program in a community that will take a certain number of people referred directly from the inpatient service or the emergency room, referred directly from jail, referred directly from the police, so that the stakeholders where the reduction in services is anticipated have a direct benefit by not having to serve the same people over and over again, and have direct access to that housing first program.
Right. Yeah. And there are some isolated parts. You alluded to some in Bergen County. In New Jersey, there are some really great programs that are working in conjunction with both public and nonprofit, as well as other institutions such as law enforcement and criminal justice system, or hospitals through Fuse projects and so forth, that have really taken that perspective. I think the critical piece, to your point, is getting more of those conversations to scale, so that we can really figure out how to use the available resources in the way that serves the consumer best and doesn't just put Band-Aids on future experiences of homelessness. And, I just wanted to ask you, that in terms of addressing the needs of persons experiencing homelessness, some people also hesitate, not just at maybe the cost, but to your point earlier, explaining the model. We're not requiring folks to participate in their own recovery in the ways that conventional programming might have required prior to accessing housing, right? It's engagement, it's keeping in touch, it's making sure that those things are available to a consumer as they become necessary in their service need. So can you just speak to folks who argue the point of,
are we setting folks up to fail because we aren't requiring things? Why is this the better methodology for someone who might not be learned about housing first and might not believe that it's the right way to go? Is this more effective than the old way? What is the compelling reason there?
Well, like I mentioned about how this thing was developed, when we compel people or we demand that people do things a particular way, that's effective. But now that we've done randomized controlled trials and taken, 1,000 people and let them go through the system that compels treatment, sobriety, and housing, we've learned that about 40% of them at the end of the year have made it into housing. Okay, so it's not that it's not working, and people will, operating those kind of programs, will say, look, here's Jerome. He just graduated from my program. And Jerome says, this program saved my life. Those are testimonials. And any program that's in business should be able to deliver a testimonial, especially at their annual fundraising dinner. Otherwise, they'd be out of business, right?
Sure.
Testimonials are not data, right? No one's looking at the data. Housing First programs, the 1,000 people that went into Housing First programs, housing and then service support, at the end of that same year, 80% are stably housed and keeping their housing. 80% or 40%. That's what we're looking at. So I think it is counterintuitive. It's totally counterintuitive because when you look at someone on the street, a couple of things go on, I think, psychologically. We think the person looks to be in such bad shape, we can't imagine them looking any better. We think that this person really needs help. You're probably thinking nursing home, but maybe they're not that old. Definitely shelter. They need some help. They can't imagine that this person that they're looking at is actually remarkably resourceful because they have just spent 2 years surviving on the street. I can tell you I wouldn't make it, and I don't know about your resiliency skills, but it takes a lot of skill and stubbornness and creativity and all kinds of, just to survive, to know where you can get your meals and where it's safe to sleep and where to go to the bathroom and how to not get arrested and figure out how to make $700 stretch for a whole month. People are remarkable just by virtue of their existence. They have more skill than we ever give them credit for. So this idea that this person can't possibly go into an apartment is an illusion. It's an illusion. It's not actually true, because when you invite that person into an apartment and they take a shower and get some clean clothes, the next day you see them leaving the building and they don't look any different than any of the other tenants in that building. It's that dramatic a transformation. It's just environmental. It doesn't mean that they have a job or that their mental illness is gone or they're not desperately poor. It doesn't fix everything, but it does fix homelessness right away.
Yeah. Yeah. And I really appreciate you bringing that aspect of, contradicting what people think of as a stereotypical experience of homelessness, or as a passerby, right? Just not knowing the context of someone. So appreciate your perspective as someone who has actually known individual people and learned from them and helped them inform these best practices that have now become so accepted, if not completely implemented everywhere, very much accepted in the mainstream. And I would ask, if you wouldn't mind, Sam, if there's anything else you felt like, if I'm a practitioner or I'm someone who's concerned about solving homelessness in New Jersey, what else would you share with them? I'm going to try to make sure that I link to some of the resources and some of the studies that you alluded to in your commentary so that they have those for reference or for discussion amongst their peers. But what else from your lens is important or needs emphasis?
I think that the one thing we haven't talked about is something about the quality of the service. We've talked about services, but not so much how the service is done. Because you can talk about case management or you can talk about, nursing, but the how matters more than the what. And the people that we're engaging who are homeless, for the most part, are disconnected from family. They don't have other people in their lives. So that as a practitioner, you have to have a value set that is comfortable with working with the person in a very different way than the usual professional power structure, power differential, you're the expert and like that. You have to be comfortable in a much more humanitarian and collaborative approach, where if you're really doing person-centered care, that person's going to tell you what they want next. You may have reservations about it. You may think it might not work, but you have to be willing to do things their way and to support them in their own journey. You have to be flexible and not think about your role. Oh, I'm a psychologist. I don't go to the post office with people or do grocery shopping. If you're really going to help people with what they want, you have to go grocery shopping with them. You can do therapy when you're shopping for apples and broccoli, and it's an approach to committing to helping the person with what they want in the sequence they want it, rather than being stuck in your own role definition. So it's not hierarchical. It's got a much broader definition of service, quote unquote, and basically do whatever it takes. And also it's long-term, not for everybody, but people always want to know, oh, now they're housed, like when will they have a job? These are people that 40 years ago, they would have been in the state psychiatric hospital for the rest of their lives. So now that they're living in the community is like an amazing accomplishment for them, but they need the supports ongoing. So you have to be not pressured by the funder or some other imagined arbitrary goal, like are they moving on? Many people do move on, but some people will need that kind of support for a long time. And it's not a failure, it's just a reality of what people need. And there's no one else. Are you comfortable substituting as their family? And what I think that anyone, I don't know, any one of us, who's listening to this conversation, if we had a family member who was homeless, I bet we could solve their homelessness very, very quickly. We could solve their homelessness we would figure out, stay with this one for a little while, we'll get a place of your own, we're going to figure it out. We're not going to say, oh, there's a housing shortage, oh, the real estate market's out of control, oh, the government isn't doing this. We would solve it. And that's the approach that would be useful to bring when you're operating a Housing First program. Forget about program, forget about everything. The next person that walks in, this person, I'm going to help them solve this thing, whatever it takes. That's the right ethos.
I can't expand on that anymore, Sam. I can't add anything to that. That was beautiful. I think it's exactly what folks need to be reminded of is we get stuck in our day-to-day framework, and there is a higher calling that we have that really is to love and serve those who need the assistance, whether we are in a program mentality and a funding shortage or a housing shortage or not. It's a worthwhile challenge to work together to overcome. So thank you so much for your perspective and for being here, sir. It was an honor to have you.
Pleasure to meet you, Jay. Thanks for having me.